Every time you get an X-ray or an MRI or a CT scan, that image has to go somewhere, right? Well, it goes into this massive, complex digital library that's really the lifeblood of modern medicine. But what if that library was left unlocked? Today, we're going to dive into the hidden world of the critical system that stores our most sensitive medical images and the huge effort to keep it safe.
So at the very center of all this is a system called PACS. The easiest way to think about it is as the digital heart of a hospital's imaging department. It's the central hub that takes in, stores, and gives doctors access to every single medical image from every type of scanner they have.
Basically, the PACS handles the entire life cycle of your medical image. It grabs the image from the scanner, zips it across the hospital network, lets a radiologist pull it up, mark it up, and then files it away in your medical record. Honestly, without it, modern patient care would just grind to a halt.
But, and this is a big but, because this system is so central and so connected to everything, it also presents a massive cybersecurity challenge. And this really gets us to a critical vulnerability in our entire healthcare system.
It's a fair question, right? I mean, if your medical scans are in there, you want to know that system is locked down tight. So if PACS is so incredibly important, why is it so vulnerable?
Well, the experts at the National Institute of Standards and Technology, or NIST, they put it perfectly. They say the system offers a broad attack surface. Now, that's just security speak for saying there are a lot of doors and windows an attacker could try to get through.
And here's why that attack surface is so huge. A PACS doesn't live in a bubble. It's connected to dozens of other systems, patient records, billing, you name it. It's usually a patchwork of brand new machines and really old legacy equipment, all from different vendors. And you have this huge group of people who need access: IT staff, doctors, nurses, even outside technicians. Every single one of those connections, every old machine, every user, is another potential point of failure.
And the stakes? They couldn't be higher. This isn't just about stolen data, this is about patient care. A ransomware attack could literally shut a hospital down, delaying life-or-death diagnoses. Data theft could lead to identity fraud on a massive scale. And maybe the most terrifying one, data alteration. Imagine a criminal adding a fake tumor to your scan, or even worse, removing a real one. The consequences for your health would be devastating.
The good news is, there's a plan. In response to this massive challenge, NIST developed this incredibly detailed guide. It's basically a blueprint for how any healthcare organization can defend its medical imaging systems.
And at its heart, the whole framework is built on three really simple but incredibly powerful principles. First, defense in depth. So don't just build one big wall around the outside, build multiple layers of security inside the system. Second, strict access control. Know exactly who and what is on your network, and only give them the bare minimum access they need to do their job. And third, intelligent monitoring. Don't just sit around waiting for an alarm to go off. Actively hunt for anything that looks weird or out of place. Now let's look at that defense in depth idea. This is a tactic called micro-segmentation. Instead of one big, open network where everything can talk to everything else, you create these tiny, isolated zones for critical devices. Think of it like a castle. Sure, a moat around the outside is good, but having locked doors and guarded hallways inside the castle is way better. If an attacker gets into one room, they're trapped. They can't just wander freely through the rest of the building. Then for that second principle, strict access control, it really means moving way beyond simple passwords. We're all getting used to this now, right? Multi-factor authentication. It requires not just something you know, like your password, but also something you have, like your phone, or even something you are, like your fingerprint. It just makes it exponentially harder for a bad guy to pretend to be someone they're not. And that third principle, intelligent monitoring, is a total game changer. See, old-school antivirus just looks for the fingerprints of known bad guys. This new approach, it uses behavioral analytics to learn what's normal for your network. It figures out how your CT scanner usually acts, so if it suddenly starts trying to call a server in a foreign country, the system flags it instantly, even if it's a brand new, never-before-seen kind of attack. Okay, so this all sounds great in theory, right? But is any of it just theoretical? Not at all. To prove this could actually work in the real world, NIST went from principles to practice. They actually built a fully functional miniature hospital imaging environment right there in their lab. And this part is absolutely key. They didn't use some futuristic experimental tech. They built it using the same commercial, off-the-shelf products that any hospital can go out and buy today. They brought in all kinds of technologies from partners across the industry to build out every single piece of their framework.
You can see it here. Everything from that network micro-segmentation we talked about, to multi-factor authentication, to secure cloud storage. This whole project proves that the solution isn't just possible, it's actually practical.
So let's zoom out. Why does securing this one little corner of a hospital's IT infrastructure matter so much? Well, because it's really about the future of patient safety itself. As our healthcare system becomes more digital, more connected, and more reliant on data every single day, our trust in that data has to be absolute. Securing our medical images isn't just an IT problem to solve, it's a fundamental patient safety imperative. At the end of the day, this is the only number that matters, 100%. When a person's life is on the line, patients and doctors need to have 100% confidence that the medical images they're looking at are accurate, private, and have not been tampered with. In healthcare, there is zero room for doubt.
Now, this work by NIST gives us a really clear roadmap for getting this right, but it also leaves us with a critical question we all need to think about for the future of healthcare. As our medical technology becomes more and more powerful and more interconnected every single day, are our defenses keeping pace?